We reached the second milestone in this first day of our free Patient Safety Awareness Week 2023. Today would like to say hello to Dr. HEBA Muhammad GOMMA, who will share her experience and knowledge with us in this session that was titled by the Strategic Priorities in Patient Safety. Dr. HEBA Muhammad GOMMA is a radiology technician, quality coordinator in King Salman Center for Kidney Diseases. She is a radiology technician, Health Technician Institute in Aswan. She is a healthcare quality management. He earned healthcare quality management diploma, and she is a certified professional healthcare quality CPPS-tricks. She earned a Master of Business Administration from International Business School of Scandinavia, MBA from IBSS, the Internet Core Competency Certificate 2021. Thanks, Dr. HEBA. Start, please. تفضل يا دكتورة.
Okay, thank you. شكرا يا دكتور.
الله يخليك.
السلام عليكم. Welcome to all.
وعليكم السلام ورحمة الله وبركاته. شير السلايد بتاعتك يا دكتورة.
Hello, السلام عليكم. Welcome.
معلش يا دكتورة، الصوت بس عندك في المايك مش ظاهر. دكتورة هبة.
I want to talk today about strategic priority in patient safety and how we can make our healthcare safer more. Okay. Like we know, patient safety is one of the key components that circle for preventing patient harm. It's so important in our healthcare to make our organization more safer, and like we know, the patient safety is preventing patient harm. And second one, ensuring proper healthcare outcome and reducing redundant cost for healthcare provider. Without patient safety, adverse events lead to patient receiving the wrong care. According to the WHO organization, 1 in 10 patients is harmed while receiving healthcare service. Half of these adverse events are preventable. Like we know, in our healthcare, we can prevent more harm for the patients, and we can prevent this from from our patients, from the healthcare provider, or even the patient also. Then Here, our objective, providing a high-level architecture of safety strategy will support frontline leader and organization. It can be this strategic priority. We can make it for all, not only for staff. It can be for our leader, even the organization. We can use this all strategic. In devising an effective safety program, find a blend of strategy and intervention appropriate to the context and organization. Our mission and vision. The vision, we envision health system where patient, provider, and another work together to build and advance a safer healthcare system. Providers take pride in their ability to deliver the safest and highest quality of care possible, and every individual in need of healthcare can be confident that the care they receive is the safest in the world. And our mission to provide leadership in building and advancing a safer health. Imagine that you are the leader and you want to make strategic in your organization, and you don't have you are not able to have more time or more cost. You are concerned about safety, but you have limited time and resources. You plan a program lasting 1 year initially and perhaps extending to 5 years. Like we know, strategic, it will be like for the future, going to future, where you want to be a sheep. Okay, and you have limited of time and resource. We need to ask ourselves 3 questions. What should you do to improve safety in your healthcare organization? What we need to improve? We should think about it, and we should ask ourselves as a leader what we need to improve safety in our organization. What safety strategy available to you? What you have to do, and what you like we told before, we don't have even resources. We don't. It's limited of time and resource. What safety strategy available you can do in your organization? How can this strategy be most effectively combined? What option do you have for improving safety? We should be worried of modeling all future safety intervention on our most visible success, and in some highly standardized area, such as radiotherapy, or some places blood product. We are managing blood product. A combination of automation and highly standardized procedure combined to deliver gently ultra safe system. What you can see in this picture? Can you share with me what you can see in this picture and what you think about it? Hello. Can you share with me what you can see in this picture? Depressed man, yes, excellent. Regard due to error. Okay, more. SAD, yes, okay. This patient is a psychiatric patient. I want to ask, should we can make also the for psychiatric hospital or psychiatric patients standard for them also? They can we can allow for standardized system for them. Not such, yes, yeah. Root cause required, yes, Dr. Hagil. Yeah, but I am talking about we can make the system for them standardized also, or human being system for them. Not all system it can be standardized with standard. Am I right?
Somerset. We thought a little bit the Bridgewater area. It looks quite pretty. There's links to the major motorways, the road links, for me to get to the airport. I travel a lot of my job, so it's quite fast paced. So, I mean, recently when I was in the Middle East, I
A key musician, Martin.
Yes. Excellent, Dr. Ali. Human factor can be considered. Okay, thank you. Yeah. Now we will talk about our strategic to be our healthcare organization safer more. Safety as a best practice. This the first strategy. Second one, improving healthcare process and system. Third one, we will see about and we will talk about risk control. Strategic number 4, improving capacity for monitoring, adoption, and response. The fifth strategy is mitigation. Here I have questions also again. Is adherence, Is adherence to standard alone can improve safety? Excellent, yes, excellent. Yeah. Yes, Dr. Agil, you are right. Situation and circumstance also to be focused individual. Yeah, excellent. Yeah. Here, the more answered no. Yeah. We cannot improve our safety with only standard like we told before the psychiatric patient. This our example also. The first strategy is safety as a best practice. Aspire to standards reducing specific harm and improving clinical process. The most dramatic safety improvements so far demonstrate have been those with a strong focus on a core clinical issue or specific clinical process, and they may be also focused on reduction of a specific from a form of harm, such as a fall or central line infection, or increasing the reliability of a specific clinical process, such as preoperative checks. Here also aspire to standards as a best practice. The essential idea is that complying with proven evidence and the standard will produce optimal quality and safety. And like we know, many patients come to harm because established scientifically based standard or practice are not reliably followed. Safety intervention of this kind first marshal the scientific evidence, then identify the core practice and endeavor to reliably bring this practice to patient care. Here, our intervention, the focal safety programmed reduction of harm. Like what? Like reduce central line infection, and like we told also, inpatient fall reduction program, and reduce urinary catheter use and infection. Also reduce pressure ulcer. The second intervention, improved reliability of targeted process, whose surgical safety and other checklist. We can use the checklist and medication reconciliation, and also care bundle for ventilator association pneumonia. This is the example for improving reliability targeted process. Also improving safety by achieving best clinical practice. Explicitly describe the story behind the choosing intervention or provide an explicit logic model for why this patient safety practice should work. Describe the patient safety practice in sufficient detail that it can be reflected, includes the expected effect on staff role also. Detail the implementation process, the actual effect on staff role, and how the implementation or intervention change over time. We can assess the effect of the patient safety practice on outcome and possible and unexpected effect, including data on cost when available. When we are studying with multiple intervention sites, assess the influence of context on the effectiveness of intervention and implementation. Now we will talk about the second strategic with us, improvement of work process and system. Here, accident and incident analysis and other methods reveal a great deal about the vulnerability in our system and show us the range of factors which need to be addressed if we are to design a safer, high-quality healthcare system, like adverse event, or like we are using OVRs, and how to improve this adverse event with root cause analysis. Thoughtful analysis of serious incident reveal a range of contributory factors relating to the patient, task, and all our factor, task, and technology. Just a second. Here, our improvement of our work process and system, the intervention for individual staff What we can do for them: training in key clinical process, any stuff for how to improve the work for them and to be more, they have more skills we should have, and we should give them more training, education in key clinical process, and feedback on performance. The task intervention, standardization, and simplification of process. Also automation of key process. And we can do also improve design and availability of our equipment. The third one, team standardization and specification. We will make for them that when they are making of word care for our work condition, improve lighting, reduction of noise and disturbance, improve workstation design. For all organizational intervention, improve level and organization of staffing, creation of new posts to improve coordination of care for patients. For our example of system improvement, which have, amongst other objectives, had important impact on safety, include the introduction of barcoding and decision support in blood collection and transfusion, the improvement of our communication and handover for staff along the surgical pathway, using information technology to reduce medication error also, the use of daily goals sheet to improve the reliability of ward care. This all we are using in our system to improve our work for the staff or for our machines or for all our organization. We have the barcode and the decision support, communication for handover we are using in the surgical, and reducing medication error in pharmacy, like we know, and using the daily goal sheet to improve reliability of ward care. In your opinion, which risk control approach is highly effective in achieving safety? What do you think? Which risk control it's more effective when we want to achieve our healthcare organization to be more safety? Is the risk avoidance or loss reduction or risk transfer, or according to the situation, select your approach? Which risk avoidance, which risk control we can achieve more safety in our healthcare organization? Yes, thank you, Dr. Agib. Thank you, Shireen. Yes. Yeah. This answer for all. We have more. First one, Khalid, he told risk avoidance. Yeah, more. Which risk control, from your opinion, it's highly effective when we need to our healthcare organization to be more safer? Is risk avoidance or loss reduction or risk transfer? Yeah. Thank you. More answer, please. According to the situation. Yeah, thank you. Thank you to all. Here, yes, the fourth number is the correct. According to situation, we will select our approach. Some healthcare organization, they don't have ambulance. What we will do, we will transfer our patients, like we make risk transfer. For that, we will select our risk about our situation in healthcare organization. Risk control. Here, the risk associated family of intervention is quite different from the optimization approach discussed before. In many industries, safety is achieved by avoiding taking unnecessary risk or placing restriction on the condition of operation. Like we talked before, we can make risk transfer in some organization. Some organization we will make risk avoidance. Not about our situation, we can use the risk control. In contrast, healthcare seldom impose limit on either professional autonomy or productivity, even when safety is severely compressed. Avoidance of risk is not necessarily a good option for patients, either are there many circumstances in which clear sightly making a risky choice is entirely reasonable. Yani sometimes in our organization, it's not good to take the risk avoidance. We can sometimes in organization we should have our risk and we should take this risk. We should be risky to take our patient. However, risk control doesn't aim to prevent or consider a risky decision, but to improve the chance of a good outcome once the decision has been taken. Still, we are talking about risk control, and the intervention for risk control withdraw surface. Our example is closed facility if evidence of serious safety concerns. Sometimes, when we have the COVID, some facilities they closed, some special centers they closed because they don't have the infection control and they don't have the isolation like that. Some facility they closed already. Closed facility temporarily while safety assessments are carried out. The second intervention, reduce demand, reduce overall demand, and reduce patient flow either temporarily or permanently. The third one, place restriction on surface, restrict surface either temporary or permanently. The fourth, place restriction on individual or condition of operation. We define no-go condition for investigation and treatment. Withdraw or restrict individual member or of staff either also temporary or permanent. The last one, the risk control for the intervention is prioritization. Select and emphasize safety critical standard while allowing some reduction of other work, either temporarily or permanently also. Here also we will talk about, is resilience important in healthcare? Why? Why resilience is important in healthcare? For decreased financial loss from increased patient satisfaction, help staff to manage stressful and improve their health and well-being. Yes, yes. Thank you, really, Dr. Shireen and Dr. Agil, Hanim. Yeah, correct. Selma, yeah, correct. Yes, Khalid also, yes, correct. To help staff, the resilience is so important in our healthcare organization, for the staff to manage their stressful and improve their health. No need to be very strict, our staff. We need some resilience to be manage our stressful and their health and well-being. Now the fourth strategy with us, monitoring, adaptation, and response. Once we accept the error and failure occur frequently in many systems, then we see the need to develop methods of monitoring, adaptation, and responding and recovering from the failure. Adapting and responding to problem happen all the time in healthcare. What we can do when we have problem happen in all time in our healthcare? We need root cause analysis, and as relevant to manage as to front line staff, manager in practically are constantly firefighting and resolving problem. Here we will talk about the resilience. The term resilience is used very broadly in an attempt to describe and articulate the quality of a safe organization, and sometimes in a more restricted sense of a capacity to adapt and recover from extreme or unusual circumstance. Resilience also is an important concept that needs serious consideration. Now we will talk about the intervention for monitoring and adaptation and response. The first one, improve safety culture. We should improve our safety culture in the health organization. Like we know, we are all experienced in patient safety. So important we have improving our culture for safety in our organization, for patient and family culture, for opening about error and failure. Monitoring adaptation and response in clinical team. What we can do, like rapid response to deterioration, develop emergency response system and routine, develop team cross-checking and safety monitoring, building briefing and anticipation into clinical routine. The fourth intervention, improve management of organizational pressure and priorities. The example, develop method for predicting time of staff shortage and other pressure. Also improve managerial capacity to deal with dangerous situations. The last one, regularity, compressed, and adoption. Here, negotiate time to move a new standard. Also actively manage safety during time of transition.
Recording in progress.
The last one, we will talk about mitigation. The definition of mitigation is the action of reducing the severity and seriousness or painfulness of some events. And here the fifth strategy is accept the patient and indeed staff will sometimes be seriously affected or harmed during their healthcare, and critically, that the organization concerned then has responsibility to mitigate that harm. This perhaps the most neglected aspect of patient safety. The intervention of mitigation, support for patient and career. Also, we will do rapid response and clear communication, design follow-up, physiological and physical support. We will make plan clinical service for response to no complication. For supporting our staff, we will do peer-to-peer support program. When there is something happen for the staff, we should have peer review for them, support program. Temporary relief from clinical duties, provision of long-term support. In our organization also, we have insurance for financial, legal, and media response, the insurance of organization, legal protection for organization against an warranted claim, capacity for rapid and proactive media response. Also, we want to know, is innovation a really safety strategy? We can make the innovation is a strategy also. Now we talk about 5 strategies. Also, we can make innovation strategy. We can add the innovation with them also. It can be strategy. We know innovation is so important, and we can make more technology and telehealth, and we can use this in surgical machines, but it can be a strategy. More answers, they are telling all, I think all, they are telling yes. But really, we cannot make innovation as a safety strategy. It's so important in healthcare system, but it cannot be safety strategy, because sometimes when we are using the innovation, we have some risks. When we have innovation for for systems, for machines, sometimes when we will use a new system, we should have some risks also. For that, it cannot be safety strategy. But it's so important in our healthcare organization. Innovation in healthcare can take many forms, ranging from drug therapies, surgical procedure, and devices, and tests through to new form of health professional training, patient education, management, financing, and service delivery model. And our innovation aims to provide better or more efficient care for patients. And many innovation in diagnosis and treatment have had a major positive impact on safety. For this, we are telling it's so important we have innovation in our system to be with us in safety programs, but not like it cannot be a strategy. Safety in anesthesia has improved about 10-fold over the past 20 years. The rapid introduction and spread of laparoscopy surgery has reduced length of stay. And also, innovation is a good example of double-edged tool for safety. Is a critical determinant and means of improved safety in a long term. Innovation may also introduce new risk. You see here, it can introduce new risk as well as resolving old one practically in the short term during the period of transition and distribution. Selection and customization of the strategy to clinical context. Many situations do require a combination of different approach, but that need to be clear how and why each strategy is deployed. We also need to consider how this strategy and associated intervention may be combined and in what proportion. Also, each clinical environment brings its own challenge and require a different combination. Thank you. I finished my my lecture. My reference is the National Library of Medicine and the patient safety, Saudi patient safety also. This my reference. Did you have any questions?
وش تسامي دكتورة؟ ايوه دكتور.
ايوه لا بسأل لو عايزين اي اسئلة ومحتاجين.
Okay. Any questions for Dr. HEBA, please? We'll take 5 minutes for any questions.
Yes, I didn't read this, Dr. Agil. He's telling innovation may result in, yes. Yes, thank you. May result here in risk. Yes, yes. Thank you, Dr. Agil. Pre-exciting strategy are more safer.